So how do we identify patients who are at potential risk of harm? So there are a number of factors that put patients at more risk of harm from opioid use, and we've outlined some of these factors that put patients at high risk and moderate risk of harm. So if we look at the high risk, how we may kind of identify high risk patients, so that could be patients who are on doses of daily morphine equivalent up to and above 90 milligrams, which puts them at risk, more risk of dependency, and doses of daily morphine equivalent of 120 milligrams and above increase that risk of harm. So patients who are co-prescribed sedating medications and or medications associated with dependence, patients who are prescribed opioid medications for more than 3 months, and elderly patients. All of those are identified that could potentially put them in that high risk category. If we look at moderate risk, again, similarly to high risk, those doses that increase the risk of dependency and increase the risk of harm, and patients with minimal co-prescribed medication associated with dependence, and patients prescribed opioid medication for less than 3 months. Those are some of the indicators that may put patients in that moderate risk of harm group. So again, looking at those kind of indicators of dependence, these are just some of the indicators that suggest the possibility of dependence. More indicators can be found in the Faculty of Pain Medicine's Opioids Aware Guidance. So some that we would like to kind of highlight today are that repeated seeking of prescriptions for opioids with no review by a clinician, repeatedly losing medications or prescriptions, taking doses larger than those prescribed or increasing dosage without consulting a clinician, often coupled with seeking early replacements, prescriptions, associated with continued requests for dose escalations. Seeking opioids from different doctors and other prescribers. So this can take place within GP practices, often identifying locum doctors or doctors who are unfamiliar with their case. And this may also be associated with attempting unscheduled visits. So also looking at kind of obtaining medication from multiple different providers, so both NHS and private GPs, repeatedly and rapidly deregistering and registering with GPs, seeking treatment for the same condition from both specialists and GP, or seeking treatment from multiple specialists. And this may be coupled with a refusal to agree to write into the main primary care provider. We'd just like to briefly mention some of the tools that can be used for identifying patients. So we've mentioned kind of the importance of data to be used for identifying patients who are potentially at risk of harm. So one of the tools available is EPACT-2. Now that has a number of opioid prescribing comparator dashboards. It includes comparators by duration of opioids being prescribed, so you can look at that kind of up to 3 months, 3 to 6 months, and 6 months plus, looking at those kind of high and moderate risk groups, as we've mentioned. And you can look at it from high oral morphine equivalent volume. So again, looking at the volume in terms of the increased risk. So EPAC-2 does require a registration to be completed to access it. There are different levels of kind of data that are available. It can go down to patient level data, and that can be provided to those who provide direct care for the applicable patients. So for example, GP, clinical pharmacists, etc. So the second source that we'll mention is open prescribing. Now that's freely available opioid prescribing data. So unlike EPACT-2, there isn't a need to register to access that data. And it includes comparators such as high dose opioid prescribing and all opioid prescribing. So you can look at kind of quite a wide range of different comparators on the open prescribing. And that data can go down to practice level data. So unlike EPAC-2, where if you are in one of those direct care roles, you can access the patient level data, open prescribing data. It just goes down to practice level data. So another source for identifying patients would be the electronic health records. So for example, EMIS or System 1. So within this, we'd just like to kind of highlight the campaign to reduce opioid prescribing work, abbreviated to CROP. That was led initially in West Yorkshire by Dr. Sarah Alderson, and that programme developed clinical system searches for identifying kind of patients at risk through the electronic health records. So we would encourage you to have a look at that for to look at the searches that they developed, and they evaluated kind of the impact of that work as well. So we would just like to briefly have a look at the data. So this is taken from EPAC2, and we're looking here at the West Yorkshire ICB footprint as an example against kind of the national level data. So the graph that you can see here is the high, high oral morphine equivalent data. So that's patients with a daily oral morphine equivalent of 120 milligrams or more. And the data presented in these graphs is per 1,000 patients. So in the dark blue column, you can see this is where West Yorkshire are currently. It's the most up-to-date data available within EPAC2. And as you can see, that is slightly above the national kind of average across the ICBs, probably sitting slightly more towards the top end of that graph there. One of the other comparators I mentioned that you can look at within EPAC2 is opioids by duration. So again, looking at West Yorkshire ICB here against all other ICBs within England, looking at patients per 1,000 patients. So this is the 3 to 6 months duration. So as we mentioned, that kind of risk of harm increases as that duration of opioid use increases as well. So again, as you can see, the dark blue column here shows where West Yorkshire ICB are in comparison to other ICBs across England. So again, kind of more towards the high end, slightly above the ICB average. And then again, similar graph, but this shows the 6 months or more duration of opioid prescribing. So again, we can see West Yorkshire in the dark blue, and again, sitting more towards the top end, slightly above the ICB average. Hopefully that's been useful to see kind of some of the data that is available, and to look at where West Yorkshire ICB currently are in that picture. And please do get in touch if you would like any further information about EPAC2 or any of the data sources we've mentioned, and the opioids prescribing comparators dashboard. We'd be happy to support you.